Welcome everyone, and thank you for joining us today. My name is Sydney Hollingsworth, and I'm here with Elena Gonzalez. This is an abbreviated presentation of Sun Produce RX, and the complete presentation is available on the Maricopa County Department of Public Health Dietetic Internship blog. We are 2 of 5 of the MCDPH full-time dietetic interns who have been fortunate enough to receive the David Schwacke Memorial Scholarship. In the initial design of this pilot program, we collaborated with Honor Health Desert Mission Food Bank and Sun Produce Cooperative to create a solid foundation for a Produce RX program in Maricopa County. Elena and I are happy to be sharing this presentation with you today. Produce RX embodies the idea of food as medicine. The benefits of Produce RX are twofold, as it not only allows food and nutrition to be part of the healing and treatment of chronic disease, but it also provides fresh produce to those who may not have it readily accessible to them.
Our vision of Sun Produce, also known as SPRX, takes it a step further by incorporating the local food systems in order to provide tasteful local produce that has the ability to meet consumer demand for culturally relevant produce. During this presentation, we will outline a framework for a pilot program with the mission of incorporating the local food system into Maricopa County and Sun Produce, plus partners. Our goal is to create a unique Produce RX program that supports the local food system while also offering culturally relevant produce. These are the stories that show us why this work matters. We could go on and on about why we think Produce RX, and specifically Sun Produce RX, is a great model. But what really matters is the real-life impact. A similar style program demonstrated the importance of a program like this from both the participant and provider perspective. In this program, impacts range from increased access to fruits and vegetables, increased knowledge of the importance of fruits and vegetable intake, and the reduction of financial burden that fresh produce and food can have. Now let's take a look at the numbers. In a Houston Produce RX study, their estimated cost of one quality adjusted life year was $1,300, compared to insurance company willingness to pay $50,000 to $100,000, a savings of over $48,000 per quality adjusted life year. A systematic review study estimated that over the course of a lifetime, $39.7 billion could be saved from formal healthcare costs if Produce RX was introduced early on. This is all not to mention the impact to the local economy a program like ours will have for local farmers as well. For this program, we want to target a population that is 18 years and older of age and diagnosed with a chronic disease that impacts their quality of life and life expectancy.
Next, we would like to discuss the expected outcomes foreseen from this pilot program. We anticipate improved biochemical markers, behavior changes, and mental health, increased resource awareness and connection and engagement with the community, increased accessibility and quality to local produce, and increased fruit and vegetable consumption and the number of meals prepared at home. There are many interdisciplinary responsibilities in this program. Sun Produce and farmers will sell and provide food and acquire continued funding. Our clinical community partner will house the program's care coordinators, staff, educational resources, and administer the food. Pinnacle Prevention will assist with grants for the pilot and permanent programs and will assist with advocacy. Eaters, or participants, will receive boxes of local fruits and vegetables, participate in intake and follow-up appointments, and attend and utilize education resources. Healthcare providers will refer clients and patients and participate in education regarding SPRX. And community health workers and the Maricopa County Department of Public Health will connect participants with resources and support funding and resource acquisition. In our stakeholders tree, you can see the workload is divided and spread throughout each organization. We know strong relationships are what will make the program sustainable. You can notice the addition of academic institutions on the bottom right. Academic partners can assist in potential collaborations for further grant funding opportunities.
Let's move on to see what a Sun Produce RX box will contain. These boxes will provide access to local in-season produce that these communities otherwise don't have access to, as well as nutrition education and recipe cards and feedback surveys. A major advantage of partnering with local farmers through Sun Produce is the ability to meet participant cultural food preferences to increase daily fruit and vegetable consumption. Not only will sourcing produce locally provide more tasteful food, it will uplift those in the community as well.
These are the stages of the pilot phase. In months 0 to 3 will be the recruitment. The recruitment is where demographic, intake, and biochemical data is collected from all included participants. Next, in months 3 to 6 is the intervention, where participants receive the Sun Produce prescription box. In months 6 to 9, we will use the survey cards, follow-up form, and interview, and perform a community needs assessment for data collection. Months 9 to 12 is where we will analyze the complete data set through both quantitative and qualitative measures. This is where we will identify strengths and areas of improvement for the program and communicate these findings with key stakeholders. This is also a place of care coordination where participants will be connected to partner organizations. At 12 months and on, we will consider future plans. These plans may include partnering with Valley Metro to create a mobile market, volunteer coordination through a collaboration with community outreach programs, the translation of education into more languages, and a partnership with university programs, as mentioned earlier. Ideally, this program would advance to the point where insurance providers pay produce prescriptions written by healthcare providers. The possibilities are endless of how we can reach a greater population. Thank you for your time, and we are so excited to see how beneficial this program will be for Arizona and its residents.